Hello everyone, this is Mahima Chowdhury. We are here yet again with another insightful podcast episode with Dr. Anita, a senior consultant at Kolors Healthcare. So today's topic of discussion will be gallbladder disease. So doctor, while we speak about this, please explain us what is gallbladder disease before getting into the details and the symptoms and the causes, everything. So please explain us what is gallbladder disease.
First of all, gallbladder is a small digestive organ. So, gallbladder is prone to certain kind of diseases. One is gallbladder stone. That is an accumulation of fat deposits which happen inside the fluids of the gallbladder that will lead to gallbladder stones. Okay. The other one is inflammation of gallbladder. That is called cholecystitis. That is an inflammation of gallbladder where because of the other causes which had made it to get inflamed.
Okay.
And other one is gallbladder cancer. It is an highly high-end medical issue where 99% will not get prone to this gallbladder cancer.
So now that we came to know what is gallbladder is about, so what are the symptoms that leads to this disease, especially in this certain type of people?
There might be very minimal symptoms only in gallbladder disease, and this is also a very rare disease only. So people might experience upper abdominal gnawing kind of pain, and sometimes it gets radiated behind the breastbone as well. So this is what the minimal symptom where a patient can face due to gallbladder disease.
So in the initial stages of discussing these things, you have mentioned that there are three kind of things, gallbladder cancer and all. So this all happens internally. So what are the factors that affect externally outside the body to the skin? Is there anything that affects this disease causes any effects to that external part of the skin?
Externally, there will be no effects because of gallbladder disease. Only internally, there will be changes.
Okay.
And from the liver, the bile pigmentation will get filtrated to the gallbladder, where the failure happens in gallbladder, and in turn, there will be formation of the major effect because of gallbladder disease is maximum with gallbladder stones. That is how it happens.
What is the most common disease that is found in gallbladder in our system?
The most common gallbladder disease is gallbladder stone, which happens because excess fat storage will form like a lump inside the gallbladder, which remains infiltrated. So, which will be formed as stones inside the gallbladder, which can be viewed through ultrasound. The measurement of the stones, or it is disrupting the digestive system. It can be easily diagnosed and it can be subsided as well.
Okay. So is this gallbladder by any case linked to obesity?
Definitely, gallbladder disease is linked to obesity.
Every
because
disease is
basically people whoever obese is a root cause of many disease.
Many disease. Yeah.
Okay.
That's the starting problem.
Yes, correct. Because when they have the excess fat accumulation, what will happen? Earlier, once we have discussed about fatty liver, right? The fat is being absorbed in the liver. The excess bile will get secreted and it will drop into the gallbladder only. When the infiltration doesn't happen properly, even in the gallbladder also the same problem persists, whereas it will end up in the gallbladder stones, dysfunction of gallbladder, inflammation of gallbladder. So multiple problems might happen because of the infiltration of fat. Because of obesity, the fat has to be infiltrated in multiple organs. If there are little fat, only the liver does the activity. When there is excess fat from the liver, it is being filtrated to gallbladder. Here again the problem starts and it will lead to gallbladder stones.
Okay. So does losing weight help in this gallbladder disease? Does it play a very pivotal role, in decreasing it or totally preventing it from gallbladder thing?
Weight loss plays a major role here. 5 to 10% of excess weight if you shed also, that will show remarkable difference on the gallbladder disease, and it will prevent the gallbladder stones from getting into a major issue, and rather getting into from benign to malignant tumors, it will get obstructed.
Okay. So now many people try to lose weight. So in these cases, without a gallbladder, is it possible for people to lose weight?
there will be a surgical intervention where it is necessary to remove the gallbladder. It will be removed.
Yeah.
Okay, after that, without gallbladder also, the work is being carried out by the liver. Okay, the only thing what it makes difference is, from the liver the bile juice is being filtrated, it will be drained out to gallbladder. From that it will get into the digestive system. But when the gallbladder is removed, directly the digestive enzymes will get filtrated and it will drip into the digestive system directly.
So you're saying nonetheless, without or with gallbladder, we can lose weight or we can put on weight.
Definitely.
So it goes either ways.
Correct.
Okay, so we always talk about losing weight. In this case, in this particular type of disease, are the chances of putting weight on also?
Yes, because of the medications what we are taking in. Sometimes steroidal medicines might also be given by the medical practitioner. In such cases, the patients who have already affected with gallbladder might put on weight. Excess weight gain might also happen. But at the same time, the reversal effects, we can easily reduce the weight by taking proper initiative and proper care for the weight loss management.
So mostly in all the cases, I have observed personally, the people who are overweighted, for example, they go to a treatment. So most of the treatments are not successful for in any case of disease. So in gallbladder kind of disease, is it likely that they'll be safe? The losing weight is a safer option for obese people.
Yes, going forward, weight loss plays a major role in gallbladder disease. Okay, and coming to the fat management, the storage of fat in the adipose tissue can come down by losing weight with the active exercises, cardio exercises, or going to a gym or going to a aerobic exercise, or even people can practice dance. Okay. Some people will like to dance. They can go for a dance class, they can go for a swimming class. By either of the way you can lose your fat. Other than that, you can even approach for the passive weight loss procedures like cryolipolysis, massage therapies, which can even help you to burn the calories.
Okay, so in this in the motion, is it safe to perform a surgery on obese patients?
See, nowadays gallbladder surgery has become a daycare procedure. You need not stay in the hospital. Exactly. Earlier we have to stay a day priorly in the hospital, have to cut down the food intake, then we have to go into the anesthetic procedure, then open surgery will be done, and the post operative care should be done. So many things back to back we need to go if we are going in for a surgical procedure. But nowadays it is not like that. Directly through laparoscopy, the gallbladder can be removed. If the problem persists, if it is giving trouble again and again, rather to have a gallbladder with the stones in it, having pain daily, having an indigestion process every day, we can remove it. The work will be carried away by liver and the digestive system. So it is just laparoscopy will take just an hour, and only 2 to 3 2 to 3 centimeters there will be a small whole kind of thing. They will remove it, then the sutures will be done, and you can get back to your home on the same day, or you can recover in a day or two.
So there's this scopy that you have told. What is endoscopy? Like how is it related to? No, right?
Endoscopy is not related to anyways gallbladder. It is a scopy which is through the nasal layer we will be inserting it. It is like a scan. Endoscopy is nothing like nothing but a scan. See, if you wanted to check the abdominal area, we can check through ultrasound scan. If you wanted to check your heart variation, you can go for an ECG. Likewise, when you wanted to go for a digestive system check, there will be a camera at the tip of that scopy. So that will be done inside the digestive system, but that is not related to this gallbladder.
So now we know that gallbladder is very important to the body. So when it is removed from a person's body, so what type of food intake that person should carry on for rest of his life, his or her life?
See, gallbladder is basically related to digestion. So when it has been completely removed, the entire thing has been taken over by the liver and the rest of the digestive system. So better to avoid sticky food, greasy food, spicy foods and all. More of fibers you can have. Liquid diet, you can get into a liquid diet for a while. So these are all the things which helps a person with a gallbladder disease.
Okay, now that we have spoken about the food intake for a person with no gallbladder, how does a person's life change after this? So will that give a great impact on a person's life, doing what he likes, do's and don'ts, and also is there
Not
anything
at
like
all.
that?
Gallbladder is a small organ which is just assisting for the digestion. It doesn't play a major role in the digestive thing. So, even with the gallbladder or without gallbladder, a person can lead a very normal life. He or she can be in a very normal, active lifestyle, provided follow up with the regular food habits and exercise, the basic healthy life pattern. He or she can lead to have a healthy
Okay.
lifestyle.
So, and again, we are linking this with obesity. So, how about a person with obesity, like their internal parts, how does it affect gallbladder system? Person with, a people with obesity disorder, how does it affect their gallbladder system?
See, people with obesity have more fat accumulation. That is the reason the fat has been absorbed and infiltrated in the multiple organs like liver, gallbladder, and it gets into the digestive system. Then only the excretion process will happen. Okay, so definitely the obese individuals have most of the obese individuals are prone to gallbladder disease. To avoid that only, the calorie burning capacity should improve. The people who are under medications for gallbladder stones can get into a healthy pattern of diet, can get a advice from the dietitian and follow up with the low fat low protein diet.
So this thing I already know the answer, but this is for our viewers. This again coming up. So how do you reduce weight loss in gallbladder? Like what are the precautionary steps that needs to be taken during the weight loss that when the gallbladder system is present in your body?
See, reducing weight it involves first basically it starts from exercise and food only.
Again,
So yes, exercise seems to be physical activity seems to be a mandatory thing for every human being. As age goes on, we are prone to more of diseases like diabetes, hypertension, high cholesterol, gallbladder disease, fatty liver. So many conditions are under the risk of obesity. So better to go for a regular physical activity, have lean meat foods, have more of grains, vegetables, fruits, and get into doctor's advice regularly. Go for an ultrasonic checkup after 35 years of age. Every year we have to go for a full body mass health checkup. These are all the basic things where you can prevent so many medical issues and even fight the medical issues.
Yeah. So nowadays, personally, if I take for myself, I'm very obsessed with tea, coffee, everything on that day to day life. That's what keeps everyone, to keep moving in other schedule of life. So people with gallbladder in that system, they say that there are gallstones. So can people drink coffee or tea or any other liquid item with these gallstones present in your body?
See, first of all, people with gallstones should avoid coffee
Coffee.
because caffeine in it will disturb the digestive system entirely.
Entirely, yeah.
So, coming to tea, a person with gallbladder disease can have turmeric tea, peppermint
Herbals.
tea. Yes,
Yeah.
completely herbal tea they can have.
Yeah.
Apple cider vinegar. Like that, you can go for a complete herbal remedy if you are very much obsessed with these kind of
Not the
liquid.
dairy products you
Yes,
suggest.
yes, better to avoid it so that your digestive system will be well working and you will not be prone to such kind of getting a medical issue, then treated with it, then taking
Exactly,
medications to stop all these things.
It's a very
If we
huge
are
process.
aware of it, we can prevent these kind of medical issues earlier.
So this again goes to people with no gallbladder, right?
No gallbladder and with gallbladder,
Gallstones,
yes,
yeah, it's all
you
the same.
have yes, the diet pattern will be same for every individual.
Yeah.
Because we can the person who has gallbladder and or prone to gallstones can follow this kind of diet or liquid things which has to be avoided and which has to be taken. They can be aware of it, so they can prevent these kind of medical issue.
Okay. So again, it's the same thing again. What is the age group of people getting gallbladder disease? Because it's an internal part. So people or the infants, if they are treated very well since their childhood itself, and if they maintain a successful, healthy lifestyle, So there are no chances of them getting gallbladder disease.
Gallbladder disease is a very rare disease only. Even if it occurs also, it will occur only in 40 plus age. The middle age only it will start.
Okay.
Not for children, it will not happen.
Not even for teenagers.
No.
Okay. So over the span of years, after processing all these things, at the age of 40 itself, you'll gallbladder.
Yes,
occurs.
because we are allowing the gallbladder disease to come into our body. That is
Because
how I
of
can say.
unprocessed food again.
Yes, correct. So better to be on the safer side. We have to be aware of the healthy lifestyle from the childhood. Nowadays in schools and colleges, they are educating about the food pattern, everything. And we have dietitians in every corner and streets. So earlier, nobody will go to a dietitian to have a healthy diet plan and all.
Now though everyone are having the personal dietitian.
Yes.
So
And so many apps are there, and even online consultations are going on. So we can start having a healthy pattern of food habits from the childhood itself.
So if I have discovered that I have a issue with gallbladder. So I'm approaching a doctor. So what are the treatments you suggest for me as a doctor to avoid this gallbladder thing? It might be medicinal. I just want to know again if there are medicinal, the changes, or it will be only on procedural basis.
See, if it is on the initial stage, it is just a gallbladder stones with no symptoms. You need not worry. You need not take any medications at all.
Okay.
So, if it is creating some symptoms, that is, if it is creating some issues, if you have a digestive problem, or if you are have an unbearable pain where you cannot tolerate, you can take medications as per the doctor's advice. And in the later stages, if the inflammation is more and hyperinflammation is already caused, so that swelling is there, in such kind of cases, surgical intervention like removal of gallbladder, that can be we call it as cholecystectomy, that can be advised by the medical practitioner, and the patient can undergo for the surgical procedure.
So this treatment will go on for like how many hours for say?
See, surgical procedure is a daycare procedure, as we discussed already, and they can get back to their home on the same day or in the very next day from the hospital.
I think that was like very insightful and very useful information for me personally, because I'm going through UTI thing. So I just want to know again, is this related to UTI anywhere?
No, gallbladder disease is not related to UTI.
Not UTI.
Not UTI.
So how do you know, how do you find out the difference of the pain, like, if it is UTI, or if it's UTI pain, or if it's gallbladder pain?
See, if it is gallbladder pain, as I already explained you, it will be on the upper abdominal region.
Okay.
For UTI, you will not feel pain
It's
in the
the
right
lower-
abdomen.
yeah.
Right
Okay,
abdominal
okay.
region. You will not feel any pain.
Okay.
So differential diagnosis will be done by the doctors. If you are approaching, if you have an unbearable pain in the abdominal region, there are different points in the abdomen where one particular point it is because of appendicitis, and the other part, if you see, epigastric pain will be there. If there are kidney stones, a pain will be on one particular region. If there are gallbladder stones, the pain will be on the other particular region. So there will be a differential diagnosis in the abdominal region that your medical practitioner will take care. So according to the diagnosis, the medications will be prescribed.
If appendicitis and gallbladder are taken out from your body at the same time, will that clash anything?
It will
from your
not
internal
happen on the same time.
No.
See, appendix infection and gallbladder inflammation will not happen at the same time. That and all very rare case. It hadn't happened anywhere. But if that is the case, removal of appendicectomy is separate and the removal of gallbladder is separate.
So again, the food choices, it will be the same. You have to maintain.
Yes, you have to maintain with a balanced, healthy diet only.
Because now that you have lost two important parts of your body.
But you will be under rest. You will be under post-operative management for it, and it will take some time to recover if two organs have been removed at the same time. But generally, that will not
won't
happen
in most of the cases. Well, thank you so much, doctor, for this useful information. I say this is like very helpful for the people who are still trying to figure out. I basically had this differences between UTI and gallbladder. Since I just spoke to you now, I came to know. So people who are watching this, I hope this video will help them in any way possible. So thank you so much for watching. We'll be back again with another yet insightful video from Dr. Anita. Thank you so much. Thank you, doctor.
Thank you.